A major announcement in the battle against COVID-19. Pfizer says its coronavirus vaccine is more than 90% effective. The company says it anticipates seeking emergency use authorization from the U.S. Food and Drug Administration soon. Now we are getting a closer look at the vaccine distribution plans in Kansas and Missouri. Good afternoon. I'm Laura Moritz.
And I'm Kelly Eckerman. Investigative reporter Matt Fleener is live at St. Luke's Hospital on the Plaza with more on what he's discovered today. Matt?
Well, Kelly and Laura, doctors here at St. Luke's eagerly awaiting this vaccine. That good news today, Laura, that you mentioned, the Pfizer vaccine, and then also some guidance from the CDC to both Kansas and Missouri health departments. Hope Monday morning with news of Pfizer's success during its vaccine trial. On the same day, KMBC9 learned both Missouri and Kansas have received feedback from the CDC on their statewide vaccine distribution plans. Kansas publishing this final plan Monday. Missouri will publish an update to its draft plan later this week.
There won't be large quantities of the vaccine when it comes out first. At least that's what we're being told now.
Johnson County, Kansas public health authorities are planning for vaccine rollout, but know it will take months before vaccines will be widespread enough for distribution, especially after going through safety testing.
So it's very important that we get the word out. Yes, the vaccine will be safe. It will go through the different steps that are needed for that.
In both Kansas and Missouri, generally, healthcare workers taking care of COVID patients are scheduled to get the vaccine first, followed by people living in long-term care facilities. Then it will ramp up to the general public.
We will get a vaccine, but we just have to wait. We have to do the best we can do now.
Now, there are a couple of potential challenges, including cold storage of the vaccine and the need for 2 doses of shots, depending on the type of vaccine. Those are all details that are still getting ironed out. Matt Fleener, KMBC9 News.
Both Missouri and Kansas officials say they received positive feedback from the CDC on their plans.
How Missouri moves forward will be apparent Tuesday. KMBC's Michael Mahoney says the state's head of the COVID-19 fight will talk about where the state is and where it needs to be.
To go in and check everybody.
The director of the Missouri Health Department, Dr. Randall Williams, will testify before state lawmakers in the morning. The number of cases in Missouri are rising. The latest 7-day average, well over 3,000 new cases a day. Dr. John Patterson, a Lee Summit lawmaker, will chair the committee where Dr. Randall testifies tomorrow. And he wonders if Randall may adjust the state plan.
Well, I think we're certainly approaching where we have to look at it. You know, I for one, think the governor has done a good job, but the case numbers are not what we've seen in the past.
Patterson wants people to wear a mask, but does not support a statewide mask mandate. Plans to practice on how Missouri will deliver a vaccine were supposed to start last week, but they didn't. Frontline health workers will get it first, then the elderly and the most at risk, and workers vital to Missouri services and industries. And the vaccine will be free. Tuesday, lawmakers start working on how to spend $1 billion federal CARES Act money dollars that the state already has.
Testing and PPE. If we can really focus on those things, that really helps the most, and I think that's where the money is best spent.
Meanwhile, St. Louis County is considering more business restrictions. In Wichita, a lot of City Hall is now under quarantine, and Kansas City is worried at this point about the availability of hospital beds. Michael Mahoney, KMBC 9 News.
Last week, when Governor Parson won his election, he vowed not to shut down the state because of the virus. The news comes as both Kansas and Missouri see a record number of cases. In Kansas, 7-day rolling average now stands at 1,800. In Missouri, it's at more than 4,100. The state is up almost 1,500 daily new cases compared to last week. Both states are also seeing a spike in the percentage of positive cases. Kansas is now over 20%, and the state of Missouri is close, coming in at 19.5% positive.
And Missouri's largest county is out with a dire warning now. St. Louis County officials say new restrictions will be necessary if COVID-19 is not brought under control. Right now, St. Louis County requires face coverings. County Executive Sam Page says due to the rising cases, drastic measures could be announced next week. Now, there's no word on what those restrictions could be. He says no one wants to shut down the economy, but we can't stand by as the virus continues to rage the community. The Johnson County, Kansas Health Department is holding free COVID-19 testing all week. It goes from 8 a.m. to 2 p.m. every day at the department's Olathe location on Sunset Drive. You don't need to have symptoms to get tested. You can make an appointment at jocogov.org/coronavirus.
President-elect Joe Biden is giving the pandemic priority when he takes office. Biden has pledged to work toward making at-home coronavirus tests available to the general public as soon as possible. Now, we asked the COVID-19 panel at the University of Kansas Health System how realistic at-home tests are anytime soon. Dr. Steven Stites says fast-tracking at-home tests is something the medical community has been working on for months.
It would be a game changer just to say, if you could check yourself every day at home and you know you're positive, so you can't go out and you're negative, okay, I can go out, I can go to the Chiefs game or whatever, then I think, man, that's a lot better. That would put us in a much better position.
The doctors say the considerations are whether it is an antigen test or a saliva test and how fast a person can get those results.